My name is Britt. I'm a dental hygienist, and we're going to talk about if you should be a dentist or a dental hygienist. And this is from a dental hygienist point of view. These positions are very different, so I'll probably need to do a part 1 and part 2, but I'm going to break down what I do as a dental hygienist. So on a daily basis, I would say I would see 8 patients a day, 1 hour per appointment. And within each visit, I would be doing medical history review. I would be doing oral cancer screenings, hypertension screenings. I would also be doing perio charting, which includes doing gum measurements and measuring things like bleeding and recession and mobility. I would also be talking to the patients about airway, their bite, alignment possibly. I'd be taking their x-rays and talking to them about any potential treatment that I might see in the x-rays. Doesn't mean I'm diagnosing. I'm just pointing out suspicious areas that may need treatment, but doctor would have to be the one to diagnose. And I'm basically prepping the patient for when the doctor comes in so that the doctor can already say like, oh yeah, Britt already talked to you about that spot, like I see it there, you're going to need a filling, you're going to need a crown, whatever. So basically I know what the doctor is going to diagnose and I know how the doctor is going to treat it, but I personally as a hygienist cannot legally diagnose treatment. In addition to all of that, we are also providing our patients with oral hygiene instructions. So this could be like going over electric toothbrush, manual toothbrush flossing, water pick, what products they should be using. We're also scheduling their next visit and helping in sterilization and flipping our rooms. So it is like necessary for hygienists to have help because we are like mid-level providers, but a lot of the times we are working alone. And even while we're doing the cleaning, most of the time we don't have somebody helping us with suction or anything like that. So we are mostly working alone until the doctor comes in and does an exam at the end of the appointment. I personally love being a hygienist because I am independent. I pretty much work alone and the doctor comes in and diagnoses what they need to diagnose for restorative work. But for the most part, I work alone and I like to treat my patients and I see them for pretty much like 95% of the appointment, and then the doctor comes in at the very end and does an exam. But the thing that is really tough about being a hygienist is it is hard on your body. So a dentist is typically working in like one area of the mouth, so they can sit in like one position and work in that one spot. But for us as hygienists, we are cleaning the entire mouth in one appointment. So that is a lot of twisting and turning and different angulation, and it's hard on your body. If you're not careful, your career will end quick. Overall, I love being a hygienist because the link between P. gingivalis, which is the bacteria in your mouth, is becoming more and more strong to how it affects us systemically, and hygienists are going to be the next big thing, let me tell you.